Good afternoon, everybody. This is Dr. Jeff Culbert from Schooley's Mountain Chiropractic Center. You know, one of the last videos we did, we went over the different phases of care, from relief care to corrective care to long-term wellness care. And we used the example of what goes on with the cervical spine with a couple of patients. Today, I wanted to let you know what can actually happen, not only what we did with the neck the last time, but what also can happen with the lower back. So the story that I'm going to go over with you today is the story of a gentleman by the name of David, who was a patient of ours a number of years ago, before he got out of the Long Valley school system and retired and moved away with his wife. But this young man, marries a German woman, and he goes over to Germany with his wife, and as he over in the airport in Germany, he reaches forward from the carousel to pick up his luggage and bend and twist and pull it down beside him. As he reaches over and lifts, he feels a sharp pop and a searing hot poker pain in his lower back. The next thing that started, he's crippled over onto the floor, tries to get up, he's all hunched over and antalgic, and he's got raging sciatica going down his leg. He guts out the trip to Germany, which is about 2 weeks. He comes back here, immediately calls in to come into the office. I said, gosh, David, it sounds like you have a herniated disc going on. The fact that you were bent over, you felt the pop, you felt the sear, and then came on the sciatica, and you're antalgic, walking off to the side. It just lets me know that there is a disc more than likely there. I think what we need to do is order an MRI, and upon ordering the MRI and looking at it, we found a rather degenerative disc with a rather large disc herniation. So he wanted to go and get an opinion from an orthopedist, and the orthopedist said, Dave, you need lower back surgery immediately. David came back into the office and said, orthopedist wants to do surgery. And I said, Dave, I don't think you need surgery for a number of reasons. Yes, you're antalgic. Yes, it hurts to cough or sneeze. Yes, you're experiencing sciatica, but you're not showing any of the signs and symptoms that would warrant you as a potential surgical candidate. You have no foot drop. There's no slapping of your foot when you try to walk. You have no loss of bladder and bowel control. Some of these things are the things that make you an immediate surgical candidate. You went over to Germany, you herniated the disc, and yes, it's irritated and it's inflamed. You did not get care, and you did not ice it down. You did not get any treatment at all. For 2 weeks we were over in Germany. So this process that you're going through with this herniated disc has 2 to 3 weeks of swelling and inflammation at this point in time before we're going to get started with anything. I said, do me a favor, give me 4 to 6 weeks to work with you, and if you're not showing improvement in 4 to 6 weeks, I'll drive you to the orthopedist and I'll let you go in and schedule the surgery. But give me 4 to 6 weeks. Now, if during that process you start to exhibit foot drop, you start to exhibit loss of bladder or bowel control, trust me, I'm going to send you right back over there, if not to the emergency room, and have them get you set and ready to schedule out for surgery. David thought that approach made sense since he didn't have any of the signs and symptoms for being an immediate surgical candidate. So we started working with Dave, and lo and behold, in 4 to 6 weeks, we had enough of the symptomatology under control. The sciatica had reduced just to lower back pain. The lower back pain went from crippling to bedridden to moderate, in terms of filling out the Oswestry pain questionnaires and disability index scales. So he showed a significant improvement in that 4 to 6 week window that we were looking to do. Once we got him to that point, I said, okay, Dave, we've gotten through the relief process of care. Now what we've got to do is start to transition you into corrective care. So here's where we start with basic exercises and stretches, open up that space a little bit more, as well as start to strengthen the psoas muscle and the quadratus lumborum muscles, which were extremely weak on this gentleman, because these are the stabilizing muscles, the ones that allow you to bend and to twist and to lift your leg. That's the psoas muscle, the one that allows you to bend and lean to the side and stabilize yourself so during gait you can walk without drooping. So we started to work on those in the basic exercises. And then lo and behold, Dave stayed with us and got things strong and corrected. And then we moved him into what is known as a wellness-oriented program of care. Because he worked up at the school, in the janitorial capacity, he was doing a lot of bending and twisting, and so we generally would see Dave anywhere from every week to 10 days to 2 weeks, and this process went on for a number of years. And then one day, Dave came down with bronchitis, and he did a tremendous amount of coughing and sneezing. And the next thing that started to happen is his lower back started to hurt when he was coughing and sneezing. So our first immediate thought, knowing how bad the disc was, and I'm going to show you what that looked like in just a moment, how bad that disc was, we we ended up saying maybe we should get a repeat MRI, see if anything has changed with that disc, since it is hurting to cough and sneeze, generally a good indication that there is some problem going on with the disc. So when we got the MRI done the second time, we saw and found some very amazing things that just gave extra credence to how and why, when you sometimes don't see physically or with your eyes what's going on, sometimes you need that reinforcement by ordering additional diagnostic testing. So it was fortuitous that Dave ended up coughing and sneezing with his bronchitis, tweaked the disc, did not herniate another disc, did not re-herniate that disc, but tweaked the disc. So there's a little pressure on it from inflammation, created a little bulge to hit the nerve. But overall, we were extremely happy and surprised. Once we got him over the irritation from the coughing, he went right back on to doing his normal routine, coming in every week to 2 weeks, getting adjusted, doing his exercises and drinking his water and doing everything that he should be doing, with one little minor setback about a 4-year period in. So without any further ado, what I want you to do is pay attention to this top x-ray. And again, I want you to pay attention to that when you look at the discs, you see most of the discs are nice and white. That white in the disc indicates that the disc is well hydrated and has a lot of water. But you're going to notice that this disc here between L4 and L5 is really very black. And what you notice is behind these, everything looks really nice and white within the spinal cord. And then as we get to this black level, you see this big black disc herniation. Big black disc herniation coming in and really pressing in on that cord area, creating all that pain and discomfort. And obviously, because the L4 nerve is the first nerve that starts the sciatica, that's what was accounting for that sciatic nerve pain. So as we've gone on, we start to take care of Dave, and then lo and behold, what ends up starting to happen, he tweaks and irritates the disc. Now again, as you look down at these discs, you still start to see and notice that white, 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 and it's gray, and it's gray to black. And we get down here to that same level when we're doing a different slice through the disc with the MRI, you start to see that there's white coming in there and shades of gray. So over time, and you notice that big black bulge that was there, okay, is now pulled back in. So we had the ability, as we were opening him up with what we were doing with the flexion tables and getting him adjusted here, giving him the flexion exercises to do, slowly over time stretching and opening up that area, along with the other exercises. And the key for this was making sure he was drinking sufficient quantities of water, 1/2 to 2/3 of his body weight in ounces of water alone a day, okay, so that there was no caffeine or alcohol dehydrating him. We made some significant changes to that disc herniation, so that again, this is just another example that it's important to get through relief, because when you're in pain, the first thing you want to do is get out of pain. So I'm the fireman who's putting out the fire with a hose. Once we've got that fire out, you do not want to leave that house and live in a burnt out shell of a house. You want to reconstruct and rebuild the spine, just like in a fire, you're going to rebuild your house. And once that house and spine is rebuilt and strong and fortified, then the key is to maintain that so that it doesn't fall back into disrepair, and then activities of daily living, okay, and or trauma will bring back a problem, only this time multiplying it because the weaknesses has stayed there. So in this particular case, we're showing you how long-term wellness care really made a significant difference in the life of one of our patients who had a severe lower back disc herniation. So last time we showed you what goes on with the neck. This time we're showing you what can happen with the lower back with long-term wellness-oriented care. Well worth the investment. So with all of that being said, I really hope you enjoyed the information, not only in the last couple of videos, but this video as well, to know what can go on long-term with wellness-oriented care in a chiropractic office, even when it can be something as serious as a low back herniated disc. It's not always you have a disc and it's a trip right into surgery. You gotta work the process, take the pressure off, decrease the inflammation, open up the space, allow water to get back in and hydrate, and it's gonna go through corrective and long-term wellness care. So if you like the information here, I'd hope you hit like and hit subscribe and then share it so that more people can get information about chiropractic care and the true wonderful benefits of a long-term wellness-oriented care. And then from there, if you're interested in anything that you've seen here about Schooley's Mountain Chiropractic Center, go visit our website, smcc4u.com. Hit the information information section about our homepage, a little bit of information about me and the staff. Any questions that you might have, you can always shoot us an email. Go on to ReviewWave and then shoot us a question. Give us a phone call. Our number's on the website, so give us a phone call, leave us a message. More than happy to get back in touch with you at any point in time. And with all that being said, I am Dr. Jeff Culbert from Schooley's Mountain Chiropractic Center, your leader in alternative healthcare. Thanking you for your attention today and looking forward to seeing you in a video coming up real soon.